medication use process and medication use system occurs. All the slides that I'm about to disclose to you are actually specifically taken from USP Chapter 1066. And if you recall from sterile compounding and other courses, whenever we talk about USP chapters, the FDA reserves the right to enforce any USP chapter under 1,000. So 1066 is really a guideline, a suggestion. It's not a requirement like 797 and 800 and similar such. The categories they talk about are illumination, interruptions and distractions, sound and noise, physical design of the workspace, and then also this concept of a medication safety zone, which is really great in theory. Practice implementation of it, I've seen it done and seen it done successfully, but it really is, the devil really is in the details whenever you talk about implementing medication. So looking specifically at illumination, so of course, if you don't have proper lighting, then you can miss things. One of the concerns that they specifically mention in the chapter is that employees aged 45 and older generally require an increased amount of lighting relative to those employees that are under the age of 45. The recommendations that they make is to create non-glare, make sure we're utilizing non-glare computer screens, make magnifying glasses available. There's very much a stigma in asking for a magnifying glass should one be required, and so making those just readily available just kind of removes that stigma component, and so someone is far more likely to use it to examine a product more closely. One that tends to get missed is light fixtures not being cleaned, especially if they're encased. So if we don't clean them, we actually see a light level decrease of 25% over 2 years. We saw that very rapidly within our pharmacy. You'll also notice, to kind of enhance illumination, you'll notice that a lot of pharmacies will use light colored work surfaces to enhance the illumination within the pharmacy itself. There is a specific set amount of illumination. We can measure illumination at 100 lumens per cubic foot. I wouldn't worry about memorizing that number. It's kind of inconsequential. It's just more important to know that there is a recommended guideline. They do suggest that we do keep a guideline and monitor the illumination in particular work areas that we may have concerns. So examples may be checking counters. Other examples may be that are not inside the pharmacy may include areas where medication preparation occurs, so if nurses are having to do sterile or non-sterile manipulations. And other concerns may be more related to like automated dispensing cabinets, making sure that towers are lighted and the like, so that our nurses that are removing drugs can see those things clearly. Interruptions and distractions. It should be no surprise to anyone that distraction is the cause of nearly half of all medication errors. As I mentioned, a large number of our errors happen at the point of prescribing by our providers, and then also at the point of administering by our nurses and supportive staff. And it really shows that those people are overtasked and over distracted with many and various sundry things. So anything we can do to enhance our processes to mitigate the impact of distractions on our system is definitely desirable. The thing to remember too is even within our pharmacy, the types of errors that occur as a result of distractions. I have my own personal experience of an error that very potentially could have been absolutely tragic. And it was purely to the fact that somebody asked me a question, I turned my head, and I mislabeled 10 IVs that contained midazolam with fentanyl. And fortunately, there was someone there that was able to catch my mistake before it ever left the pharmacy. But the thing to remember there is that everybody has a different level of distractibility. Everybody has a different ability to manage those distractions. And what's really funny is every single one of us thinks that we're much better at this than we actually are. It's not a weakness to, whenever someone asks you a question, you're in the middle of a critical process, it's not a weakness to say, hang on one sec, I just want to finish this process first. It's not rude. It's actually the most appropriate thing to do for the safety of your patients. First off is to minimize potential for distractions in critical use areas. So if you have a check-in counter within your pharmacy, it's always a good idea to pull that away from areas with distractions. One of the biggest concerns that I have is the fact that we're putting pharmacists, while we're trying to enhance visibility of the pharmacists, community pharmacies placing pharmacists at the front counter is just absolutely asking for trouble. They're supposed to be verifying medications, and if they're constantly being distracted more so than they already were, then there really is a good chance for errors. If you have a check-in counter within your hospital pharmacy, it's a good idea to keep it away from noisemakers as well. So a lot of pharmacies have pneumatic tube systems that they can use to send medications, kind of like a bank sends that little pneumatic tube system to your car, send medications up to nursing units, and it really does create a constant source of noise. And so keeping those types of things, keeping phones away from check-in counters and the like, while they may seem efficient, they just increase the distractibility of the person performing what is in no other way to describe as a critical process. Also, and this is a hard one, employees should really avoid interrupting one another for non-urgent reasons while they're performing any type of task related to the med use process. And this is hard because we're all busy and we all need have something that we need right that second. And so it's one of those things that it's always better to, rather than just asking your question, if somebody's performing a task that's critical, saying, hey, I have a question for you whenever you're done. And that puts the ball in that person's court as to when they feel comfortable stopping and then answering whatever question you have. So really consider that. That's probably the one thing I'd highlight from this to consider on your rotations is realize that there is patient care process going on there, and make sure that whenever you are interrupting individuals, that it's for absolutely critical elements, or if you are interrupting them, that you're doing it kind of in the most appropriate way. Other things you can do to enhance this to prevent distractions is something that other industries such as the nuclear industry and the airline industry have used for decades is the utilization of checklists. And so that way, if you are interrupted, you can come back to that checklist to perform the activity. Some of the things we do, like verify medications and the like, it's a little harder to utilize a checklist because we're doing it so many times. But longer medication processes like compounding hazardous drugs and things like that, we can use checklists as a tool. Other things to consider are physical barriers. So there is a reason, and I think we've forgotten that, there is a reason that the pharmacist check-in counter is far back away from where the customers come to in a community pharmacy. That physical barrier is absolutely critical to reduce distractions. Within other pharmacies, you'll see sterile compounding labs. One of the great things about those labs is that most of them are now sealed to prevent contamination, but it also creates that physical barrier to prevent interruption as well while they're doing a very critical process, probably the most error-prone process in the whole medication use system. Visual cues is also another way, and I can't remember if it's discussed on a slide later, so we may come back to it, but one of the things that I've seen implemented successfully, and it sounds extremely dorky, and it sounds like one of those things that you would never want to do because it's the equivalent of a dunce cap, is people that are involved in the medication use process. So for example, a nurse going to administer a drug, if they're going to do that critical process, they actually had a red vest, basically like a cross-guard vest they would put on to indicate that they shouldn't be interrupted. That's just one example, one extreme example of the visual cue. There's other visual cues that we can use, like for instance a card that we can put out or something along those lines. Sound and noise. So just to give you an idea of what a decibel is and where normal range is, average noise level is going to sit somewhere between 45 to 65 decibels. Whenever you get to shift change, when everybody's saying hi to each other, and whenever people are passing off report, and people are getting settled into their lockers, and they're getting everything situated for their next shift, and some people are gathering their stuff to leave, decibel levels double to triple average noise levels. And so shift change is one of those times that errors love to happen. And this can be nursing shift change, this can be pharmacy shift change. it tends to be the absolute worst time for medication use processes. So, us as pharmacists, to help our nursing colleagues, one great thing we can do to minimize the risk here is to time medications away from shift change. So some things that we can do for sound and noise to create quiet areas for critical medication tasks. So whenever we think about where we want to place automated dispensing cabinets on nursing floors, we probably want to place those away from the nurse's station, even though the nurse's station always seems like the most logical place. Many facilities will have completely secured med rooms. And so these are exclusively for medication storage, and so they fulfill two goals: one, for the medication security, and two, to create that quiet area. Also to consider, especially within pharmacies, is to have, especially hospital pharmacies that are encased, is to use materials on your ceiling, wall, and floor that can reduce sound. As nasty and dirty as carpet can get, and as difficult it is to clean, placement of carpet can really reduce the amount of noise that happens. Also recommended is to use sound levels in key medication areas to see how high sound levels have gotten. One tool that I used in my last pharmacy is they make a stoplight, and this stoplight is sensitive to sound, and it's actually originally designed for kindergartner classrooms where noise levels can get too high. And if noise levels get kind of high, then the green light on the stoplight turns to yellow. And then if it gets too high, the red light goes off, and then some sort of alarm will sound to let you know that the sound in the room is too strategy. And kind of entertaining for your staff too. One thing to consider too is the physical design of the workspace. One thing that we think about is that some of us are shorter than others, and not only can shelves be unreachable, but they can also be poorly visible, and so we may not see medications stored in certain areas. The other thing that we see is cluttering of drugs. So a lot of times if we have kind of catch-all bins for non-formulary meds, or if we have return bins where we have a whole bunch of prescriptions lumped in, it's very easy to get these drugs mixed up and confused. So one thing whenever we have shelf products is to store medications at least 1 inch apart. Make sure that the height of our workbenches and storage areas really facilitate efficiency and visibility. So just because you have that shelf that's at 7 feet tall doesn't mean you should use it. Another thing to consider is that things fluctuate, you grow, so whenever we talk about this is medication safety zone, this concept is really a great concept but hard to implement. So a medication safety zone is any critical area where any of the steps occur: prescription, transcription, preparation or dispensing, administering, and then also monitoring. I'd put in this category too. Examples of this: so if you have a check-in counter, automated dispensing cabinets, or some hospitals, very few, still do a cart fill, so a medication cart. And anywhere, I'd say probably the highest risk medication safety zone is going to be anywhere where compounding and repackaging occurs. Also, if you have nooks outside of a pharmacy where physicians or pharmacists or whoever are performing monitoring or prescribing, those areas should really be kind of closed off and considered medication safety zone. When we design these areas, or when we look at these areas for opportunities to redesign them, we should really consider it like the cockpit of an airplane. So if you consider a cockpit, really everything that you need to see is readily available. You don't really have to dig for anything, and everything is there to control. It's also secluded. Whenever we talk about how an airplane is controlled and how the pilot does everything, I mean, they don't get up for anything. They barely move. Only their arms and hands move. And if you ever watch it, it's a really smooth, fluid process. Things are arranged in such a fashion that their hand moves from control to control to control with the least amount of movement. The other thing about a cockpit is that it prevents unauthorized access. And I don't necessarily mean that from the perspective of a non-pharmacy person getting in the pharmacy, but more it prevents people from passing through. It creates solid barriers. So physical barriers are always a good idea.